more information with you all been mentioned, we will be discussing this afternoon.
Hello, everyone. My name is Alexis Lavoy. As Sylvia mentioned, I'm the Health Education Coordinator, and mostly my job goes around the social determinants of health. And I also manage the Increased Access to Care Plus Learning Collaborative. And thank you for joining us through this webinar.
Okay, so now we'll move forward. Our learning objectives for today. By the end of today's session, we want you to be able to have a better understanding of the relationship between classification, uniform data system reports, and health center funding. We also want you to be familiar with the industries and tasks that meet the federal definition of agriculture that should be taken into consideration when you're classifying your ag worker patients for UDS reporting. We also want you to be able to be familiar with the different classification types for ag workers. And ultimately, we want you to be able to utilize this newly acquired knowledge to accurately classify and report your ag worker patients in your UDS. So as we get started, just to let you know a little bit about our organization, we are the National Center for Farmworker Health. We're a private nonprofit organization located in Buda, Texas. And our mission is to improve the health of farm worker families. And this is our 45th anniversary year. So we've been doing this for 45 years. And we work with the 174 federally funded health centers that provide primary care services to agricultural worker families, as well as other organizations that serve ag worker families. And we do that by providing training and technical assistance, products and services related to the ag worker population, including this training that we're doing today. And most of our work, or actually all of it, links back to the Ag Worker Access campaign. So hopefully you all are familiar with the Ag Worker Access campaign. It was launched in 2015 as a joint initiative by the National Center for Farm Worker Health and the National Association of Community Health Centers, which is NAICS. At that time, the number of ag workers being served in our health centers was not keeping pace with federal funding increases. And so health center staff and other advocates knew we could do better. So the Ag Worker Access campaign was launched to increase those numbers of ag workers being served. And since the campaign was launched, we have seen a steady increase in the number of ag workers served in our health centers throughout the US. And actually, our 2019 information shows that we have exceeded the 1 million mark of ag workers served. And that's the first time that we've reached 1 million served in the history of the program. And the goal of the campaign is to reach 2 million. So we're halfway there, but we want to go to 2 million and beyond. And we need your help to do that. We need to continue working toward increasing access to care for ag workers. So the campaign focus is around 4 main areas. We want to make sure we understand and address the unique needs and barriers of the migratory and seasonal ag worker population and the barriers they face related to accessing healthcare. And if you participated in last week's webinar, which was the orientation to agricultural worker health, we discussed a lot of those issues, and that's available for playback if you are interested in viewing that. We also want to ensure that community and migrant health center staff receive the training and technical assistance they need to effectively outreach to the ag worker population and accurately classify and report them in UDS. So that's what we're doing today. We also want to identify and disseminate promising practices for increasing access to care for ag workers. We know that health centers are doing a great job in coming up with out-of-the-box ideas to increase their ag worker access. And so we want to make sure that we share that so that other folks can replicate that. And then also we want to support local and regional state coalitions between health centers and other ag worker serving entities. So when we talk about ID and registration of special populations, there are several reasons why it's important to identify a patient as a member of a special population. The federal government has identified groups of community members that have limited access to healthcare services and have unique challenges in accessing those services. And they include patients that are experiencing homelessness, the migratory and seasonal ag worker population, veterans, patients served by school-based health centers, and patients served at a health center located in or immediately accessible to a public housing site. So the federal government provides funding to support the provision of health services that specifically target these special populations. And today we're talking specifically about reporting for ag worker special populations, but it's important for you all to identify and report all of your special populations, not just ag workers. And all health centers that receive federal funding, 330 funding, are required to report these populations, regardless of whether they or not they receive special population funding. So the UDS stands for the Uniform Data System, which is a government required electronic reporting system mechanism for health centers that are funded under the Public Health Service Act, Section 330. That includes community health centers, programs for migrant health or migrant health centers, healthcare for the homeless, and residents of public housing. So the things that are reported in the UDS are number of patients served, the types of services provided, clinical processes and results, types of staff employed by the health center, types of funding and payments received by a health center. And all of this information is vital to understanding a health center's impact in expanding access, improving quality, and then of course, reducing the costs of healthcare. But the most important reason that we report is of course to be in compliance with the requirements of the federal government. If we receive federal funding, we want to make sure that we're being accountable for those funds and show a return on investment for that funding. So when health centers apply for funding, they'll list in their application the number of farm workers they're planning to serve. So if they receive the grant funding, that comes with obligations. So they have to comply with HRSA program requirements for PHS Section 330. Of course, they have to provide the services that they say they're going to provide for this population, and then submit those UDS reports. And then of course, if they're able to do that, then that pretty much, there's a great likelihood that they will be able to continue their funding. And this is an excerpt from the 2020 UDS Manual, pages 39, 40, and 45. And we will include a link to the UDS Manual in the chat for you, so you can refer back to it if needed. So health centers that receive Section 330 funding have to report their special populations for ag workers, like we said. If you are receiving migrant health funding or 330G funding, then you're going to list your migratory and seasonal ag workers in line 14 and 15, and then your total in line 16. If you're not receiving 330G funding, then you would just report your total number of migratory and seasonal together in line 16. But if you're receiving 330G, you have to break it down into those two categories. So we'll go over the how to do that in a little bit. So verification, classification versus eligibility. And this comes up a lot when people ask us questions. They'll say, is this person eligible for services in our health center? So I want to really stress that classification of a patient for UDS purposes does not impact their eligibility for services. So community migrant health centers can serve anybody, but they must determine if a person seeking care is a special population and report that for UDS. And then if they have a sliding fee scale, that's applied to everyone. So it's not specific for ag workers or another population. Their sliding fee scale goes across the board, the same for everyone. So when we talk about verification for what we're talking about today, we're talking about a special population designation. So we're talking today about ag workers. Your other special population designations, again, are homeless, public housing residents, school-based health centers, and veterans. That's the verification. That's what we're talking about today. Eligibility is specific to things like your sliding fee scale. So for example, people at or below 200% of the poverty level with or without insurance, whatever your guidelines are for your health center for your sliding fee scale, that's across the board, and that's the eligibility. So today we're just talking about verification. So in order to verify migratory and seasonal ag worker status, we need to know three things. Basically, we need to know the definition of agriculture, the types of tasks and industries in ag that are included and excluded under the HRSA rules, and then the classification of ag workers, the steps that we're going to go through to classify your ag worker population. So this is the definition of agriculture as defined in legislation. So basically it involves everything from prepping the soil, seeding, planting, growing, picking, packing, and even transporting in some cases. So farming in all of its branches. This is very specific to migrant health. So agriculture means farming in all of its branches to include crop production, animal production, aquaculture, and then those support activities involved in those industries. So, and the way that we can verify which of those industries and tasks are included is to refer back to the North American Industry Classification System, the NAICS. So these specific NAICS codes, 111, 112, 1151, and 1152 are the ones that are included in that farming in all of its branches. So 111 is crop production, 112 animal production and aquaculture, 1151 are those support activities that relate to crop production, and 1152 the support activities that relate to animal production. And they're very specific. So we'll include the NAICS website as well, and you can go back and search by keyword for a specific thing, and you'll see everything related to that keyword. And then you can go back, and if the code starts with a 111, then it's part of crop production, and you can include it. If it starts with 1151, that's a support activity. So it's going to be a longer number, but it'll have that beginning to it. So when we talk about crop production, the 111, we're talking about things like grains and nuts, fruits and vegetables, nurseries, and other commodities like tobacco, cotton, hops, and even Christmas trees. And then support activities for crop production include what you see here, harvesting by machine, packing and processing on the farm versus a factory off the farm. So again, if you refer to those NAICS codes, you'll see the difference. And then transportation. We list transportation here. That also cannot be an independent company. If the transportation is affiliated with the farm, then you can include it in this support activity. If it's an independent trucking company that's not associated with the farm, that's another NAICS code. So that would be different. And then 112, animal production and aquaculture. So here we're thinking about dairy farms, animal farms, poultry farms and hatcheries, and then even fisheries, so fish farms. This is different. When you think about the fish farms, keep in mind, we're not talking about like deep sea fishing or something like that. We're talking about cultivation. So the fisheries where you're raising the fish, not just going out and catching what's already there. So there's a little difference there. And then other animal production, these are things that you may not think about that are in your area that can be included in ag, in the definition of ag. So raising and growing animals is a commodity. So fur-bearing animals, if you have bee farms in your area, the bees, crickets, and worms, lab animals are even included. And then companion animals. That was one that was surprising to me when I looked at the definition, was the companion animals. I didn't think about that as agriculture. But companion animals such as dogs, cats, and birds can be included as well. And then the support activities associated with that include boarding, branding, even reproductive services, and livestock spraying and cleaning. And again, you can refer back to those NAICS codes and look at the specifics. So these are some examples of tasks performed by ag workers. And it's important to be aware of these tasks because ag workers often will not self-identify as migratory and or seasonal agricultural workers when they come into your health center. So it's important for us to be aware of the tasks. So when they describe what they do, you can kind of ask more questions and get to find out if they're a migratory or seasonal ag worker. So some of these things include preparing the soil, seeding plants, detasseling, harvesting, sorting, preparing, processing, and transporting, storing, and distributing. Again, on the transporting, if it's associated with the farm. So these are just some things to keep in mind. And it's a good idea to be really familiar with the industries in your area and find out what some of those tasks are, and maybe create a little cheat sheet for your front desk staff. So when they're having that conversation with patients, they can kind of, if they say, okay, are you a migratory and seasonal ag worker? No. Well, what do you do? Well, I work in detasseling. Okay, well then let's ask some more questions and find out if they can be classified as a migratory or seasonal ag worker. And then these are the excluded tasks and industries. So again, these are the NAICS codes for them. So 42447, meat and meat product merchant wholesalers, landscaping services, spectator sporting, and trucking and timber. So tree farming is included, Christmas tree farming, but trucking and timber would not be included. So, and the exceptions would be like if someone is participating in work in these industries in the off season. So if the majority of their time if their primary employment is working in ag, but then they do one of these industries or work in one of these industries in the off season, that would still work because you're working on you're thinking about the other job that they do. And a question that often comes up is nursery workers versus landscaping. So nursery workers are classified as ag workers because they're engaged in growing the plants. So like I said before, from planting the seed to all the way to harvesting, and nursery workers do that. Individuals who work in nurseries are producing the seedlings for market. They're doing things like prepping the soil, watering and caring for the plants as they're growing. So they would be classified as ag workers. And this includes even if they're growing flowers. So, but individuals who work for commercial or retail nurseries are not considered ag workers. So that's an exception there. And then landscaping companies, they're mostly maintaining yards. They're not producing the plants. So therefore their work would be a different NAICS code that you see here. So they would not be considered agricultural workers. Another question that's come up is, what about someone who works with racehorses? And that's part of the spectator sporting industry. So if an ag worker is raising and caring for horses on the farm, anytime within the last 24-month period, they could be classified as an ag worker based on the tasks that they're doing there. The backstretchers, the workers who solely take care of the horses on the racetrack, would not be classified as ag workers because they would be considered part of that spectator sporting industry. So again, but if an ag worker is working with the animal on the farm and then also helping on the racetrack, then if their primary job is on the farm, then you can, because you're not taking the racetrack part into consideration. Another question that's come up is, what about raising chickens for slaughter? So the tasks related to raising the chickens are qualifying tasks, and the worker could be classified as an ag worker, regardless of what the chickens are being raised for. The activities specifically related to the slaughter, though, would be a different industry and would not be included in the definition of ag. So those are just a few examples, and then we'll go through some more at the end of the session as well. And if you think of anything as we're going along, please be sure to enter it in the chat, and we'll address it at the end of the session too. So these are the 6 steps of the Agworker verification process. And if you follow these 6 steps, pretty much you'll be able to determine if a person is a migratory or seasonal ag worker pretty clearly. So and we'll go through each one in detail along with verifying questions that we recommend you include in your registration forms. So step 1, we want to establish their occupation. We want to make sure that they are an agricultural worker. We want to determine the time frame. And the key here is to remember 24 months. In the last 24 months, have you worked in agriculture? Step 3, we want to determine if they're migratory status. So are they a migratory worker? Step 4, are they a seasonal worker? Step 5, we also want to identify former migratory workers. Those would be the aged and disabled former migratory workers. And then step 6, we want to remember the family members because they would be classified the same as their ag worker family member. So step 1, we want to establish the occupation. Is agriculture their principal employment? So again, verification questions should be included on the registration forms. And here your health center will need to define what they mean by principal and what principal employment means for your health center. You'll need a policy and procedure in place to reflect the criteria for your definition. So we recommend you look back at the definition of ag that we provided here and as you're establishing that policy. So again, it's agricultural principal employment. The verification question for that is, have you or anyone in your family worked in agriculture? So we want to start with that basic question. Has anyone in your family worked in agriculture? And step 2, determine the time frame. As I said before, 24 months is the key. So have you worked in agriculture any time in the last 24 months? So the verifying question is, have you or anyone in your family worked in agriculture in the last 2 years or 24 months? And the farm worker does not have to work 24 months before you can classify them as an ag worker. It's any time in the last 24 months have they worked in agriculture. And then step 3, we want to inquire about migratory status. The verifying question here is, have you or anyone in your family established a temporary home in order to work in agriculture? So if they're a migratory worker, then they've had to establish a temporary home to do that work, whether that's going to another state or if they're going somewhere else within the same state, but they have to establish a temporary home in order to do that work. And that could be temporary home, could be renting a place, staying with family. That's not the part to worry about. The thing we need to worry about is, did they have to establish a temporary home? And then they would be a migratory worker. If they do not establish a temporary home, then they would be a seasonal worker. So step 4, if they're not a migratory worker, then we're going to find out more about their seasonal status. So unlike many other occupations or jobs, the stability of work in agriculture varies dramatically and is dependent on so many factors like weather, demand for the commodity, whatever's going on with the workforce, disasters. This instability is what defines the seasonality. So the worker may experience changes in the type of job they're doing, the hours worked, their wages earned. So they can work year-round and be perceived as full-time employees, but they're still considered seasonal if there's a change in their job responsibilities, the tasks performed, the income earned. The fluctuation is the key that we're looking for here to determine their seasonal status. So the verification question here is, have you or anyone in your family worked in agriculture on a seasonal basis without having to establish a temporary home? So, and then again, you can add a little supplemental question of, do your job, hours, tasks, or income change with the seasons? So having those two questions, that'll kind of be able to guide the conversation to find out if they are a seasonal worker. Step 5 in the verification process is to identify former migratory agricultural workers. So the Health Center Consolidation Act of 1996 expanded the definition of agriculture to include aged and disabled former migratory workers. So it's important again that if a question that one of you submitted ahead of the training was, can we count former seasonal workers that are no longer able to work as agriculture workers? And you cannot for this. If they only worked on a seasonal basis, then they would not be considered a former an aged and disabled ag worker. We're only looking at migratory workers. But one thing to keep in mind is that some of your patients may have worked as a migratory worker at some point in their career. So maybe the last job they did, or the last section of the last time that they worked was as a seasonal worker, but in the past they've worked as a migratory worker. So if they've ever worked as a migratory worker, if they've ever had to travel to work for ag, establish temporary home, then you could count them as aged and disabled ag worker, and they would be reported as migratory in your UDS. And then step 6, we also want to identify all family members. Again, the Consolidation Act of 1996 expanded the definition to also include family members. And this is regardless of a dependent's insurance status. So the family member should be classified the same as the farm worker member of the family. So if you have a migratory agricultural worker, everyone in that family would be classified as migratory. Same thing with seasonal. If they were an aged and disabled former migratory worker, everyone in that family would be considered that, and they would be reported as migratory in your UDS. And so this is the definition of family. So members of the family who are within a designated catchment area. It's up to your health center to decide what that catchment area means and who you want to include as your family members. So again, you need to have a policy and procedure in place that reflects that criteria, so all your staff are following the same procedure and are capturing that information in the same way. So just to recap the classification of agricultural workers, we have migratory ag workers whose principal employment is in agriculture. They were employed within the last 24 months. They have established a temporary home for the purposes of working in agriculture. So that's your migratory. Seasonal, their principal employment is also in agriculture. They have been employed in the last 24 months as well in agriculture, and they have not established a temporary home. So they're coming home to the same place every evening. They're not having to establish a temporary home. And then aged and disabled are former migratory agricultural workers that are unable to work in agriculture due to age or disability. And again, they would be classified or reported in your UDS as migratory. And any family members of these three categories of agricultural workers would be classified the same as the agricultural worker family member. So one of the questions that has come up also ahead of time was, why do we have to ask if a patient has established a temporary home in order to work in agriculture? So again, all health centers are required to identify and classify their vulnerable populations, which include migratory and seasonal ag workers. So that's one reason. But we also want to be able to provide clinical treatment and a plan for continuity of care. So if you know that they're only going to be in your area for a short period of time, then that's something you'll keep in mind as you're doing your planning to make sure that they have a plan in place for continuity of care. So some common mistakes that we see or that come up often are sometimes health centers conduct the verification process using short and simple questions. So some may have a form that just asks, are you a migrant? Yes or no. Or are you a farm worker? Yes or no. Or check one, migrant or seasonal. And again, as I mentioned, the patient may not self-identify as a migratory or seasonal farm worker. So that may result in you not capturing all of the patients that you're seeing and reporting them properly. So determining farm worker verification requires more than just a simple question. Not asking the right questions. And we've given you some examples of what we recommend you ask, how to ask those questions. Not understanding and recognizing all ag industries. So again, if you refer to those NAICS codes, if something comes into question, you can always go back and verify that they're under those codes that are included in the definition of ag by HRSA. And if you have any questions that come up, you can always email us and we can kind of work through those steps with you and help you figure out if you have kind of a unique case that you're not sure about. Not verifying work in the last 24 months for those currently not working in ag. And that happens, let's say someone comes in and they have, they're currently working in construction. And so you may not think to ask them, when you ask what their employer is, they work in construction, and you stop there. But really they may be working in construction just during the off season, but in the last 24 months, they have worked in agriculture. So again, making sure we ask every patient about these special populations. Not including family members. So again, you're missing people that you could be including in your reporting if you're not including the family members. And then not verifying age or disabled. So just because someone comes in and we can't suppose that they have never worked in agriculture because of their age. So we need to make sure that we are asking every person. So how do I ask the questions? So the main thing is using the right language and the easiest terminology possible. So some examples are, again, have you or a family member worked in any type of agriculture in the past 2 years or past 24 months? You can also ask things like, have you or a family member worked in the fields in the past 2 years or worked on a farm, or what type of work do you do? And then ask some more probing questions and find out. And giving examples. So another thing that you can do is have a cheat sheet, again, at your front desk that has images of those tasks and industries, and so that you can kind of have that conversation. So that's just another idea. So another thing here is if you know your local community, become familiar with the industries in your community, like I mentioned before. So you can have a list of your employers at your front desk. You can have that cheat sheet with the tasks and industries. All these things will help the folks that are gathering that information have an easier time of having that conversation and gathering that information. So what if a patient is reluctant to answer the questions? So we can always ask the question in another way. So who do you work for? What's the name of the company? What type of work do you do? Let them know why you need the information. So we want to be able to better serve you. We receive special funding for agricultural workers, and we need to keep track of that. We have special programs that we offer to assist you. Reiterate to them that their information is confidential, because that would be something that all of us would be concerned about. Why do you need to know this information? So let them know that it's confidential. You're only capturing this information for reporting purposes for classification of special populations. You're not using it for any other reason. And what if the patient is having difficulty filling out the form? So this is a common issue as well. It's important to recognize the clues that may indicate that your patient may be struggling. So I know in one of the recent trainings, someone mentioned, that they watch for if someone says, "Oh, I forgot my glasses." So maybe they're, can't read have trouble reading the questions. Make sure they understand it. So reiterate the questions, say them in simpler terms. Always be mindful of your tone of voice. We always want to be welcoming to all of our patients. You can offer assistance in filling out the form. And if you do that, then try to have an area that's a little away from everybody else so that they can answer those questions comfortably, because nobody wants to be sharing their personal information publicly for everyone. So try to find an area, if you can have an area where they can have a little confidential area to share that information with you. And then make sure forms are available in the patient's preferred language. So that's really important too, because that may be why they're having difficulty filling it out. If English is not their primary language, then yeah, they would have difficulty filling it out. The main thing is to handle the issue as delicately as possible, and so that it's a positive experience for your patient, and always be respectful of your patient. And these are some tips and strategies. So again, I mentioned earlier, implement policies, procedures, and staff training to ensure that all staff understand your population and how to accurately identify and register them. And this is for all of your special populations. You want to do that. You want to ask the right questions on the registration form. So making sure that they're very clear, simple, and easy to understand, and then provide assistance as needed. And then we want to remember to inquire about occupation within the last 2 years. Again, keep that 24 months in mind always. And then make sure that all your patients and are screened for agricultural worker status and other special populations as well, regardless of insurance or employment. So if you're asking everyone the same questions, then you're more than likely going to be able to capture the information accurately. And verification should be happening at every visit. So if you've got it as part of your procedure, then everyone will be asked the same questions at every visit. Again, having additional tools available at the front desk. So a list of ag employers, a cheat sheet illustrating common ag worker tasks. And we will be we are working on a cheat sheet that will hopefully be distributed later this year that you can customize for your area. So you can edit it to, it's already set up so you can print it as is with the examples, the visual examples of the tasks and industries, or you can customize it and edit to include tasks that are specific to your area. And then we recommend you cross-reference your adult ag workers with family members who are patients at the health center in the EHR. So again, we have had health centers that have increased their numbers quite a bit, just going back and doing checks on that and realizing they did not include family members. And then we also want to develop outreach strategies to inform the ag community about your health center services. So how are you getting the word out about your health center and the services you offer? Like, are you working with farm owners and letting them know that you can provide services that keep their workforce healthy? I mean, that's what everybody wants. So they should be motivated to have you work with them. How are you, what else are you doing to get the word out about what you can offer for agricultural workers, to let them know that you have extended hours during the growing season, or you're going to be have a mobile unit coming to their area. So just keep that in mind and develop strategies to inform everyone of what you have to offer, because you're offering a great service. So now we'll go through some case studies to kind of reinforce what we've talked about today. And we'll be using the polling within Zoom for this. So we'll have you respond on screen. So our first case study is Tomas. He's 38 years old. He's an H-2A worker that comes to the US to do nursery work and work on the apple farms. He returns home to Honduras for a few months each year after the apple harvest, though. He's in your clinic today because he fell off a ladder and might have a broken arm. So we're going to talk about how we would classify Tomas. Would we classify him as a migratory worker, a seasonal worker, an aged and disabled worker, or not an agricultural worker? And some questions to think about for each of these case studies is we want to make sure that we are asking, thinking about, has anyone in his family worked in agriculture? Is agriculture their principal employment? Have they had to establish a temporary home to work in agriculture? Did their work hours or income change for any part of the year? And did anyone in the family stop migrating to work due to age or disability? And so it looks like you guys are already responding. That's great. And the majority, okay, let's see. So the majority of you, 79%, responded migratory worker. So that's correct. So Tomas has worked in ag in the past 24 months. He has established a temporary home in the US to do this work. And even if he's at your health center today due to a work injury, again, workers' compensation or insurance or anything doesn't, we're not taking that into consideration for purposes of reporting in UDS. So he still needs to be classified as an ag worker for UDS reporting purposes. Okay. So case study number 2, we have 3 patients, Johnny, Vera, and Julie. Their father works in a local tomato and watermelon farm, most of the year, but then he works in construction during the off season. And they both have Medicaid insurance, and they're here at your health center today because they need their school physicals. So how would we classify Johnny, Vera, and Julie? And again, the same questions are on screen. Have they worked in has anyone in the family worked in agriculture? Is agriculture their principal employment? Have they had to establish a temporary home to work in agriculture? And looks like so far, everyone is responding seasonal. Okay, so the majority of you did respond seasonal agricultural worker, and we had one that responded migratory. So Johnny, Vera, and Julie should be classified the same as their father. So they would be classified as seasonal agricultural workers, and you would report them as seasonal in UDS. So again, the dad works locally, so he's not establishing a temporary home to work in agriculture, and he does work seasonally. So in the off season, he's working in construction. And then case study number 3, we have Miss Benavides. She's 72 years old, and she lives with her 53-year-old son. And her son has traveled to work in the tobacco fields for most of his career, but 3 years ago, his job changed due to his severe arthritis. So his employer gave him an office job ordering supplies for the farm. So how would we classify Ms. Benavides? And again, the questions are on screen. Has anyone in the family worked in agriculture? Is agriculture the principal employment? Have they had to establish temporary home to work in agriculture? Did their work hours or income change for any part of the year? And did anyone in his family stop migrating to work in agriculture due to age or disability? So please respond on screen to the poll. Okay, so you should be able to see the results on screen. The majority, 16 people, did respond aged or disabled ag worker. We had 18% migratory and 1% seasonal and not an ag worker. So Ms. Benavides should be classified the same as her son, an aged or disabled agricultural worker. She is a family member of an aged and disabled former migratory worker. Her son is a former migratory worker who's no longer able to travel due to his severe arthritis. So Ms. Benavides would be classified the same as the ag worker family member. And again, she doesn't have to be a dependent of her son, but she is a family member. And here specifically, she's living with her son. So now that we've gone through those case studies, I'd like to share some NCFH resources with you. Of course, our NCFH website has a wealth of information, and if you haven't visited it, we encourage you to take some time and review all the information and resources that we have available for you. We do have an Ag Worker Access campaign specific webpage on our website that includes lots of tools and information that can help you in increasing access to care for your ag worker population. We have a migrant health program self-assessment tool, so you can go through and really take a look at your current program and identify any gaps you might have in training or resources or things like that. So just kind of really taking a good look at your migrant health program, and then you can go into some action planning and set some goals for how you're going to increase your ag worker numbers. We also have an ag worker identification digital training tool, and I'll have a link for that in another slide, but that's a great resource. It's a 10-minute video that pretty much reinforces, it just goes through and reinforces what we've talked about today, those steps for identifying and classifying and reporting your ag worker population in UDS. We also have our archived webinars on our website. So this webinar, our orientation to ag worker health, and are all available on our website, as well as many other great resources for you that you can view on demand. And then we also have a toolbox that includes sample policies and procedures. And I talked earlier about making sure you have a policy and procedure related to your registration and classification of your ag worker population. We do have samples of those in the toolbox. We have sample registration forms where folks have, where you can see how people have reworded those questions to make them easier to understand and for their patients. We have some intake and registration questions to ask, and then of course additional staff training resources. And those are all at ncfh.org. And we recommend you check that out when you get a chance. Another great resource that is on our website is our population estimate maps. So this map displays the 2017 estimates of the number of crop and animal production workers in the US by county. And these estimates include crop and animal production workers, but we're not able to separate the two sectors or provide an estimated number of adult and child dependents. But you can go through, if you hover over these dots, you can zoom into your state, hover over the dot, and you'll see county information. So you can go through the counties in your service area and see the number of contracted and directly hired workers. And these are threshold numbers only, and of course could be affected by current weather conditions, labor policies, and other things, but it gives you a good idea of your population. And again, these are accessed on the NCFH website. there's an Agworker health section, and then you go into population estimates. And this information can be really useful to you in setting your goals. So like I talked about earlier, kind of really looking at your program, what you're currently doing, setting some concrete goals on how you can increase access to care for your ag worker population. And this will this is a good tool to have, because if you know how many are in your area and you look at what your UDS numbers are, what you're reporting, you can compare those two and kind of set some goals. And it helps you with developing an outreach plan, your needs assessment activities, all sorts of things. So a really good resource. We also have a web page of ag worker specific resources related to COVID-19. And this includes links to resources in Spanish and also in other indigenous languages. And we will include a link to that in the chat as well, so you can access it. And then the Ag worker identification digital training tool that I mentioned earlier. This is a great resource to have. It's a digital story, and it goes through the steps that we talked about to accurately classify and report your ag worker population. And it's 10 minutes, so it's a great refresher for your staff that have already completed a training. It's a great introduction for your staff to just become familiar with the process as well. And we also have another digital story that's specific for patients, that's in Spanish with English subtitles, that goes through the same questions. And so some health centers are playing that in their waiting areas on a loop, so that ag workers, so that their patients can become familiar with the questions they're going to be asked. And they can say, okay, yes, I do that, yes. So then they can know that they are an ag worker and better respond to your questions as well. So those are both great tools, and they're available on our website. I'd also like to share just a little bit of information about our Increased Access to Care for Agricultural Workers program. This program and all the associated training opportunities with this program were launched in collaboration with the Ag Worker Access Campaign to assist community and migrant health center staff in accurately identifying and reporting their ag worker patients in the UDS. The program has grown since its launch to include a national network. It's a national virtual network comprised of health centers, health center control networks, and primary care associations that are all working toward the mutual goal of increasing access to care for ag workers and their families. And so the program includes training, learning collaborative activities, and ongoing support. And we do have 2 learning collaboratives that are associated with this, our IAC Core and our IAC Plus, that are associated with this program. And we'll share information about the program as well in the chat. And one of the things that we do with our IAC Learning Collaborative or IAC Network is we are able to recognize a health center each year that has established a promising practice in increasing access to care. And so this year's winner is, this year's recipient is Ampla Health. They're based in Yuba City, California. And their promising practice was to integrate their migrant health action planning into their organization-wide strategic plan. And that's been really successful for them. They were able to get buy-in from all levels of their organization, have participation, and generate ideas on increasing access from all levels of their organization. So if you are part of our learning collaborative, we will have Ampla Health speaking during one of our virtual learning sessions to kind of answer questions on how they made it happen, and barriers they faced as they were trying to implement it, and all sorts of things. So congratulations to Ampla Health, and we're really happy to be recognizing them this year as this year's recipient. And the funding for our Promising Practices Award, as well as our Migrant Health Scholarships, comes from the sale of our commemorative artwork. Each year, NCFH commissions an artist to create an original image for its commemorative artwork series. So we have artists from all over the country that have created beautiful images depicting the ag worker experience. And sales of the commemorative artwork, prints, posters, and note cards support the scholarship program and our Promising Practices Award. So it's Christmas time now almost. If you're thinking of a great gift for your health center staff or anyone else that's interested in ag work or health, please take a look at our website. Beautiful, beautiful artwork, and we encourage you to check that out. And then, of course, we encourage you to sign up to join the Agwork Access campaign if you've not done that yet. As I mentioned, we've met our 1 million mark. That's a great milestone, but there's still a lot of work to be done. So we do encourage you to join your community and migrant health center colleagues and other ag worker advocates in supporting the ag worker population by being part of this initiative. And then, of course, we have national training and technical assistance partners that are also funded by the federal government to provide training and resources to health centers that serve the ag worker population. So there are 6 organizations that are the NTAPs. NCFH is one of those. But we do encourage you to check out the other organizations and see what they have to offer so that you can get all the training and resources you need. So this ends this portion of our presentation, and now we'll move on to the Q&A portion of our presentation.